I just felt that the celebration should continue until the Independence Day. And coincidentally, I just saw the post here on Instagram that Brian Mulligan, the globally renowned physical therapist from New Zealand, who actually introduced this mobilization with movements and popularly called as the Mulligan's concept or the Mulligan's approach. The textbook which he had written, the NAGs, SNAGs, and the MWMs. And we know that the NAGs means natural apophyseal glides, and SNAGs means sustained natural apophyseal glides. As an academy involved in manual therapy education over the years and targeting the global transformation through excellence of knowledge, AOMPT takes its pleasure to wish Brian Mulligan a belated birthday wishes. Brian Mulligan is also born on 10th August 2023. But his birth date is not revealed by any other organization other than the Mulligan Concept International or the Mulligan Concept Teachers Association, which is an official organization which endorses the certified instructors on Mulligan concept and also certified Mulligan practitioner courses all around the globe. So AOMPT is so delighted to wish Brian Mulligan on his 91st birthday, 91, okay? And you know the uniqueness of this manual therapist, especially as you see David Butler or Brian Mulligan, which I had observed when I directly interacted with them, is the happiness, the cheerfulness, the ability to mingle with every physical therapist all around the globe and physical therapist of all levels, even students, first acquaintance, or it is like you know people for years. Those are people who are like called as the liberated souls. And Brian Mulligan is such a living example. So we are actually blessed to share life and our time in the same era of such a living legend, Brian Mulligan. And AOMPT definitely, as a manual therapy organization, we are actually getting the best leadership where we get inspired by excellence in every form. And Mulligan's mobilization with movements are the best example of a functionally targeted treatment, especially for the joints. And weight bearing, if patient has problem in squatting, Brian Mulligan is the only person in the history of manual therapy who said, treat the squatting, make the patient to squat on day one, make that squatting pain free by giving the glides either manually or with the use of the Mulligans or the mobilization belts. And of course, once you have checked the correct direction where it is pain free, patient is able to perform, then you perform that as a treatment, and subsequently you encourage the patient to maintain that treatment effect using taping methods, which were mostly rigid or the semi-rigid types, which is also popularly called as the Mulligan's taping. So on behalf of all the members and also our President Ritusani ma'am and our international coordinator Dr. Sujanya, where they both are actually waiting for me to start the evening pathomechanics webinar today on carpal tunnel syndrome, I felt that it is our duty to appreciate and recognize the life of such a legend, okay, when he is entering into his 91 years. So we will see Ritu ma'am and Sujanya also joining us. And Sujanya is a neighbor. Okay, so she's just adjacent to the New Zealand. She's in Australia. But it's always a pleasure to see that such a senior most physio, he's still doing teaching, he's still doing traveling, and he's still editing his textbooks for the latest editions. So it's such a personality, and many people like him have actually transformed manual therapy over the years. And AOMPT derives the inspiration from Mulligan's mobilization with movements, and we evolved the articular integration in the functional neuromuscular stability course, the training course, FNST. It's an indigenous approach of the AOMPT where we train the patients having squatting problems, train the squatting on day 1, but pain free. But we improvised it, not just the articular dimension, we added the muscular control dimension by the therabands. And the neural dimension, of course, you cannot separate when it is AOMPT. So this multistructural dimension is what is actually functional. It's not just the articular alone being functional, which will help the patient in a sustained or a lasting recovery. Of course, the evidence for Mulligan concept, everyone tells that immediate recovery is the best. Short term, yes, acceptable, it is good. But long term recovery is very poor. So seeing that, I felt the necessity that we should improvise the Mulligan concept. The articular dimension has to be made more multistructural, which including myofascial and neural components, and involve the proprioceptive and the neuromuscular training together with dynamic base of supports, or it is perturbation challenges, and train the functional activity which is painful, for which the patient comes to us. Patient do not come to us because of neck pain. Patient come to us because he is not able to write because of the neck pain. He is not able to drive a bike because of the neck pain. He is not able to work on his system and the computers because of the neck pain. He is not able to work out in the gym because of the neck pain. So the patients do not come to us for pain. They come to us for functional limitation. So treating functional limitation should be the goal of manual therapy, and that was first introduced by Brian Mulligan. And a big salute to our beloved Brian Mulligan, who keeps visiting India many times. Okay, he has come to India at least 5 times, and I had the opportunity to meet him almost twice. Thanks to Dr. Deepak Kumar Capri sir, who is actually the former Mulligan instructor in Asia when he held the workshops and also the conferences few years before. So it is good to actually think about such great personalities, not after their death. Think about them when they are alive. Okay? And not just to learn what they are teaching, learn how to improve the knowledge. Okay, so think beyond what the instructor says. Utilize your creativity with the patient-centeredness. It's not like trial and error of a technique where the direction where the patient is feeling pain relief is better, so you just go ahead with the technique. No. Functional performance should be better, and at the same time, the pathomechanical knowledge has to be there. You cannot give both the glides. If a patient is having wrist extension problems, okay, you can't give a medial glide and check extension whether it is improving, or give a lateral glide and then check whether extension is improving. Point blank. What you need to know, this extension which is restricted, what is the cause? Whether it is the inferior radioulnar joint or the distal radioulnar joint, or the radiocarpal joint or the wrist joint. Ulnocarpal also is there, ulnotricutal, that joint, or it is the midcarpal joint, that is between the proximal and the distal carpal row, midcarpal, or even the carpometacarpal joint can all restrict a wrist extension or a flexion. So This we have to evaluate. And why that restriction has come, whether it is an impingement, whether it is a stretching or adhesion in the other side, or is it the synovial fluid thickness or capsule adhesions and tightness. So the clinical differential diagnosis is also important, and the pathomechanics not just in terms of which glide is improving. The fact has to be where to actually give the glide, and that glide, when you do it first time itself, you should get the improvement, not like trial and error. Okay, you keep this side and then do extension, not reducing. Okay, then the other side you give the glide, ask the patient, not reducing. Okay, then what the patient will feel. Okay, so pathomechanics is such a thing that actually enhances your clinical perspective, and these 25 webinars have been getting a huge reception from all the physical therapists around the globe. And I wanted to announce also together that our clinical pathomechanics course scheduled here in Bangalore is now kept 2 days with 2 days gap. So that means the day 1 of the workshop is happening tomorrow, that is the 12th of August, that's the Saturday. And the day 2 of the workshop is happening at 15th of August, the Independence Day, the Tuesday. So 2 days of workshop separated by 2 days, Sunday and Monday. So it's convenient for everyone, including the boy who will come here as the model. The clinical pathomechanics course is available for online option also, and it includes life membership of the AOMPT, and most importantly, these 25 pathomechanics webinars, their video recordings will be available additionally. All this at a throwaway fees. The only academy in the world providing pathomechanics courses is AOMPT from India, and we provide the clinical pathomechanics, that is for assessment and also for treatment implications. We are going to begin the carpal tunnel syndrome session in quite a while, now a few minutes. We just got delayed because of our technical issues. Not only that, we take this opportunity to wish Brian Mulligan the happiest of his birthday, and may his loved ones be blessed with his presence, and his many more students be guided in the future for so many years from him, get trained from him directly to develop the thinking beyond the box, and ensure that everyone in the world, physios, has the ability to develop newer and newer techniques similar to Mulligan, because he is human. Every one of you is also human. That is where we bring the best treatment. As science and technology and the cultural transformations happen over the years, we need treatments that has to be on tune with the latest current scenario. So in that way, AOMPT is definitely proud to provide this clinical pathomechanics course, and of course the 25 pathomechanics webinars, because our treatment is not a trial and error. Our treatment is a well organized decision making process from the patient centered perspectives and functional recovery. That is the goal right on day 1. So good luck to you all. Enjoy your evening. It's the 11th of August. Of course, it's at 24 hours after my birthday also, and I share the birthday with Brian Mulligan, okay, in one sense or the other. 1974, Brian Mulligan introduced the mobilization with movements 5 years before I was born, okay. So he's such a legend, but remember that there is a legend within each and every one of you. So do the best courses that will promote the creativity to develop newer techniques, not just to learn a protocol or a prescribed recipe of treatment and getting certified as practitioners or instructors. Good luck to you all. Once again, we wish Brian Mulligan the happiest of the birthday ever in this year 2023, the 91st birthday